Hi, I'm Bradley Kuhn. I'm one of the physician assistants at Mendelsohn Kornblum Orthopedics. Today we're going to be talking about outpatient joint replacements and how to best prepare you for a successful recovery after surgery. So first we'll start out by talking about what is arthritis. Arthritis is the loss of cartilage and inflammation of joints. This leads to chronic pain and dysfunction. There are many causes of arthritis. The three main ones are osteoarthritis, rheumatoid, and post-traumatic arthritis. So starting with the hip, this is a ball and socket joint. It's one of the major weight-bearing joints of the body. It's made up of the pelvis and the femur. The femur is then broken down into the femoral head and then the thigh bone itself, and then the pelvis is the socket. When you do a joint replacement of the hip, you remove the arthritic socket, the arthritic portion of the femur, and replace it with a metal stem, a ball, a socket, and then a plastic liner. So there are multiple approaches to hip replacements. There's the anterior approach. This is the newer of the approaches. It requires a special table and instruments. It's not found to be any better than the posterior or posterior lateral approach. The posterior or the posterior lateral approach is a more traditional approach. This requires 3 months of what's called hip precautions. When you compare the outcomes of the anterior or the posterior and posterior lateral, they're very similar regardless of which one is used. I'm going to talk a little bit about hip precautions. You'll hear me mention this multiple times throughout the presentation because it's very important to adhere to these. This is something we want you to do strictly for the first 3 months. So no bending the hip beyond 90 degrees. No bending towards the surgical leg. Also, don't want you to turn your feet in or out severely. And again, no bending beyond 90 degrees this direction either. And then also, we don't want you to sit too low in a chair or toilet seat. And these hip precautions are only for the posterior or the posterior lateral approach. Mentioning the hip precautions, now what can you do to help maintain those? Sleeping with a pillow between your legs, using a raised toilet seat so that you don't bend the hip beyond 90 degrees, using a grabber to pick things up off the floor, again so you don't have to bend over. There's assistive devices you can use to help put your socks on. Some of these are available through the hip kits which we offer. When sitting down, you want to put your surgical leg out first, partially straightened, and then sit down. Moving on to the knee. The knee is a hinge type joint. It's made up of the thigh or the femur, the shin bone or what we call the tibia, and the kneecap or what we call the patella. It also is a major weight-bearing joint. When we replace a knee, you remove the arthritic portions of the bone and replace it with a metal cap over the femur as well as the tibia and a plastic liner between the two. Your kneecap may partially be replaced depending on your surgeon's preference. There are also partial knee replacements. These are also called unicompartmental knee replacements. With these, you have to have certain criteria met. You have to have intact ligaments in the knee, and also only part of the knee has to be arthritic. If the other part is arthritic, then you need a total and not a partial. Similarly to the total, you remove the arthritic portion of the tibia and the femur and replace it with a metal piece and then a plastic liner between the two. So knee restrictions, there's a lot less restrictions after surgery with the knee compared to the hip or the shoulder. The big one is we don't want a pillow behind your knee. It's okay to put a pillow behind your foot or ankle. This actually will help you get straighter knee after surgery, but if you put it behind the knee, it can actually cause your knee to be bent more, and we want to try to maximize how straight the knee gets after surgery. Much like with a hip replacement, when you sit down, it can be helpful to put your surgical leg out first and then sit down with your other leg. We've talked about the kinds of joint replacements. Now let's talk about the major risks. The major risks are infection, blood clot, or dislocation when we're talking about hips or shoulders. Luckily, there are ways we can reduce these risks to maximize your positive outcome. So We'll start with talking about infection risk. We use mupirocin ointment, which is an antibiotic ointment you put into your nose twice a day for the 5 days before surgery. Everyone has bacteria in their nose, and reducing the amount can help reduce the infection risk after surgery. We also use HibaCleanse. This is a strong antibacterial soap. Just like the nose, everyone has bacteria colonization on their skin, and reducing the amount can help reduce the risk of infection. Good hand hygiene can be very beneficial as well. We want to wash your hands or use hand sanitizer prior to touching the skin around the incision. And then if you're diabetic, you want to control your blood sugars as tightly as possible, as high blood sugars are shown to have an increased risk of infection. The HibaCleanse soap we'll give you at your preoperative visit. You apply the soap. We want you to use it 3 days before surgery. We would prefer the last wash be the morning of surgery, but if you're unable to, you can do it the night before. We just ask that you put on a clean pair of pajamas as well as clean sheets on the bed. So to do this, we want you to get in the shower and then turn off the water. You want to use 1/3 of the bottle and lather it up. We want you to do this for 3 minutes. The soap doesn't lather well, and so you kind of have to work at it at first. We don't want you to rinse it until 3 minutes are up. The big thing about this is you don't put it on the face or the genitals, as it's a very strong chemical. Once you lather up for 3 minutes, then you wash it off. Anyone that shaves their leg, we want you to avoid this for 3 days before surgery as well. While you're asleep, you're receiving antibiotics through your IV. We'll talk next about another risk, of blood clot. Anytime you do work on large bones, whether it's a joint replacement or a fracture, you're at a higher risk of forming blood clots. This, paired with your decreased mobility, causes blood to not flow as well, and that can form clots. Clot in your leg is not dangerous, but if it breaks off and goes somewhere else, such as your lung, it can cause a pulmonary emboli, which can be fatal. So, ways we reduce blood clots. You're going to hear the word DVT prophylaxis a lot. This stands for deep venous thrombosis, but all it means is blood clot prevention. We prevent blood clots by thinning the blood. You're at your highest risk for blood clots for the first 2 to 3 weeks after surgery. After that, it decreases. The two major options we use are aspirin along with leg pumps, or what we call SCD machines, or Coumadin. How do we reduce dislocation? Dislocation can be reduced by maintaining the precautions afterwards. With hip replacements, you maintain those hip precautions for 3 months after surgery. Again, that's no bending the hip beyond 90 degrees, no crossing the knee or the ankle, no turning the feet in or out severely, and then no twisting towards the surgical leg. Another way to help maintain those precautions are with the hip kits. This includes a long-handled grabber. Again, it can help you reach things off the floor without bending over. A long-handled shoehorn, again, helps you put the shoes on without bending over. The Flex-On Sock Aid, this is again another tool to help you put socks on without bending over. And then a long-handled bathing sponge. So, what can you do to prepare for surgery? Make sure you're in the best medical shape possible. If you smoke, stop smoking. Maintain a healthy weight and diet, both before and after surgery. If you have chronic medical conditions, such as high blood pressure or diabetes, try to maximize those and control them at most. Exercise can be very beneficial. The stronger you are before surgery can really help with recovery after surgery. And don't forget to work your upper body, as you may be putting more demands on it if you have a lower leg like a hip or a knee replacement afterwards. If you take blood thinners, NSAIDs, or vitamins or supplements, we want you to stop taking these 7 days before surgery unless instructed by your doctor. Selecting a coach can be helpful. This is a spouse, a family member, a significant other, or a friend. They can help reinforce what you learn in therapy and act as a cheerleader while you're recovering. The day before surgery, a nurse from the surgical center is going to call you and tell you when to arrive at the surgical center. They'll also let you know what medications you take that you're supposed to take that morning if you're supposed to. Remember, no eating or drinking after midnight the night before. If you do take medication, a small sip of water is allowed in the morning of, and try to relax. Alright, so the day of surgery, you're going to arrive at the surgical center, and then before you're going to be taken to the preoperative area. This is where a nurse will start an IV. You're going to meet with the surgeon as well as the anesthesiologist, and the surgeon will mark the surgical site with a surgical marker. After this, you will be taken to the operating room. Surgery takes approximately an hour to 2 hours. Throughout this, the anesthesia team will monitor you and keep you sedated. Throughout your surgery, you'll be injected with a pain numbing medication that helps control pain afterwards for the first 48 hours or so. After your surgery is completed, you'll be taken to the recovery room. At this point, the surgeon will go speak with your family. You'll be monitored throughout the process while you're waking up. Once you're awake, you'll get up, moving, and work with therapy. So once you arrive home, within the first 24 hours, the home care nurse will come and open your case. After that, the physical therapist will work with you for the first 2 weeks or so in your home. They're going to monitor your incision, work with you with exercises and physical therapy, as well as monitor your blood thinner use. Hygiene is important after surgery. You are allowed to shower right away. Let the soap and water run over the incision. We don't want you to scrub the incision itself or apply soap directly on the incision. No baths, hot tubs, or pools. We don't want you to fully submerge the wound in water until the wound is fully healed. And again, no lotions, ointments, or creams directly on the incision. So physical therapy is extremely important afterwards. Staying active is very important, like I mentioned before, both before and after surgery. After the surgery is completed, we pass the baton to the patient, and the physical therapy and the work they put directly into that is directly correlated to the success of their surgery. Remember that therapy can be painful at first, and this is okay and to be expected. You can try taking medication before therapy or afterwards, as well as icing afterwards. Talking about some pain control, remember that it's normal to have pain after surgery. You're not going to have a pain level of 0. The goal is to maintain it to a level where you can complete physical therapy and ambulate appropriately. We use what's called a multimodal approach. Pain medicine or opioids are just one portion of that. With the new opioid laws, we can only give you a 7-day supply, but if you do run out, we can have you come to the office and we'll get you more medication. We also, as mentioned before, give you an injection during surgery that's a long-acting medication that lasts for the first 48 hours. Anti-inflammatories and muscle relaxers are also beneficial. Ice and rest after therapy and when uncomfortable can be helpful, and often relaxation and meditation can be very beneficial. Equipment that you're going to be using afterwards. Again, for hips and knees, a walker is needed for the first short while. Once physical therapy feels it's appropriate, they will transition you to a cane and then to walking without assisted devices. Insurance generally covers walkers one every 5 years if you don't already have one. So, when should you worry or when should you call the doctor? If you develop a temperature greater or equal to 101 degrees Fahrenheit after surgery, we want you to let us know right away. If you have intense pain that's not improved with rest or medication, if you have a very painful, swollen, or tender calf, if you develop shortness of breath or chest pain, these are things that are emergencies. If you develop a change in color or temperature of the surgical limb, or if you have a fall after surgery, we need to know right away. Remember, you're on blood thinners, and so you're going to have some bruising, but if you have significant bruising, nosebleeds, blood in the stool or urine, that's something we need to know right away. Some bruising is expected, though. If you have constant drainage or foul-smelling drainage from your incision, that's something we have to know right away as well. So, after surgery, we don't want you to have any dental work, including cleanings, for 3 months, unless it's an emergency. And then after that, you will need antibiotics before any dental cleanings or procedures. And this is for the life of the joint. If you don't have any allergies to penicillin, we generally do amoxicillin 1 hour prior to your dental visit. Either our office can provide you with this, or the dental office, whichever you're more comfortable with. Lastly, know that we're here for you throughout this whole process. If you have any questions or concerns, always let us know or come into the office. Thank you.